Uh, Hi everybody, my name is Dr. M. Niharika. I'm working as a fertility consultant in Kamineni Fertility Center in Koti branch. Today I will be discussing about uterine causes of infertility, or also called as uterine factor infertility. So this is nothing but uterus, as we know, is very important organ for the reproduction because it is the place where the baby grows and patient can deliver through the uterus and cervix to have a healthy child. So to get pregnant, to have a healthy uterus is of utmost importance. But there are some conditions or diseases in which the fertility index comes down because of the uterine cause. So the causes or the uterine factor can be divided into two conditions called as absolute uterine factor infertility, where there is structural abnormality of the uterus or complete absence of the uterus, and the non-functional uterus, meaning the uterus can be present in the normal shape and size, but it is not functioning properly to carry a pregnancy or to achieve a pregnancy and carry it till the term gestation. So that is called as non-absolute indication of uterine factor infertility. So first I would be discussing about the absolute uterine factor infertility, in which congenital conditions or congenital meaning some conditions that are present by birth can be result of which the patient is not able to conceive, and they are called as Mullerian anomalies. Uterus develops from Mullerian duct, and hence Mullerian anomaly meaning abnormality. So we know that uterus usually develops from two Mullerian ducts, right and left. When they both together club, it is forming a unification, and then the uterus normal size will develop. But there might be some abnormalities during the development due to some reasons, sometimes mostly unexplained, or it can be a genetic abnormality running in the genes, because of which this congenital anomalies of the uterus develop. They are called as the Mullerian anomalies. So here we can see this is called as Mullerian agenesis, where there is complete absence of the uterus, tubes, and then the cervix as well. Moving forward, sometimes there can be only a unilateral or one-sided development of the Mullerian duct, and it is called as unicornate uterus. Sometimes the both developmental ducts can be developed, but they don't unite in between, and hence it can be seen as two separate uteri. So two separate uterus, meaning there will be small shaped uterus, but two will be present, and hence sometimes this can cause a difficulty because of the small cavity size to conceive, and also if patient has conceived, there is increased risk of miscarriages or abortions in these patients. Other condition is uterus didelphys, where there is completely mimication of the two uteruses, meaning there are two uterine cavities and two cervix as well. This is because of the complete non-unification of the Mullerian ducts. And there's something called as septate uterus. This septate uterus is the most common condition that we see, and it usually is a cause of infertility as well as a cause of recurrent pregnancy losses, because this septum over here will not allow the embryo to get implanted, or whenever there is an implantation happening, even with the septum, because of the decreased blood supply, there is increased risk of abortions in these patients. So, and among all these different uterine anomaly conditions, septate uterus is the most commonly diagnosed and most easily correctable condition, barring which after that, after the correction of the septum or removal of the septum, patient is able to conceive very normally. Other uterine conditions require a higher end treatment, but still there is a possibility that the patient can conceive on their own, or patient can conceive with the help of infertility treatments. So that was the congenital or the by birth conditions in which the infertility issues arise. Coming to the other cause, that is the acquired cause. Acquired causes meaning the uterine size is normal in shape, that is the developmental wise the uterus is normal, but there are some conditions over a period of time that have developed in the uterus, that have been acquired in the uterus, due to which there is an abnormality arising, and hence this can pose some difficulty in the couple or the woman to conceive. So these conditions can be divided into one is being the musculature abnormality, where the uterine muscle abnormality. This condition is called as fibroid, in which mass is formed within the uterine musculature. It can be of varying sizes and shapes, and its locality, where is it exactly located, could be one of the reasons why there are fibroid. This is called as fibroid or myoma, leiomyoma, and this can cause difficulty in conceiving, and also it is one of the reasons why there is an increased risk of miscarriage as well. So that is uterine myoma, and there's another condition called as synechiae or adhesion formation or scar tissue formation within the uterine cavity. As we can see here, that the uterine cavity, there is some adhesions or developing due to which the endometrium doesn't grow properly, or this decreases the size of the uterine cavity and hence doesn't allow an embryo to get implanted, and be one of the reasons for infertility. This incidence of synechiae, also called as the Asherman syndrome, is increasing nowadays because we see many people undergoing a lot of uterine curettages, be it because of the abortions or diagnostic purposes. And there are also patients who are undergoing myomectomies, which in surgery of myomectomy, that is nothing but a surgery done to remove the fibroids. Whenever the endometrium is being damaged or sutured in this myomectomy surgery, then also there is a chance that the patient can develop adhesions and end up in Asherman syndrome. And infective endometritis. Endometritis is nothing but the infection and inflammation within the endometrial lining. As we all know, endometrial lining plays a very crucial and important role in achieving pregnancy, because it has to undergo certain changes in the endometrial pattern for the endometrium to accept the embryo at the right time and the right place. So if it is infected, if it is not functioning properly because of the endometritis, it can also be one of the reasons why there is infertility. So this is a normal uterine cavity, and this is the cavity after the adhesions. So after we also have to see, with the uterus comes the cervix, the part that is lying partly in the vagina and partly above the vagina, and this can also be one of the reasons why there are infertility. Cervical stenosis or tumors within the cervix, or cervix being very small, for the sperms to be traveling from the vagina to the uterus. Sometimes there might be difficulty when there is a difficulty in the passage, or infections here can also be one of the reasons why there is infertility. So developmental abnormalities of the cervix, sometimes the uterus is developed but the cervix is not developed, and henceforth it is difficult for the sperms to travel from the vagina to the uterus, and therefore there is difficulty in conceiving. So now I would like to discuss detail about the major conditions that we see, that is fibroid, adenomyosis and uterine polyp. These are the acquired conditions most commonly seen in the uterine causes of infertility. So fibroid is nothing but, here this is the muscular layer of the uterus, and there are developmental of masses from the muscular cells, and this is a benign, meaning non-cancerous development of the mass. This can vary in different sizes, being around from small 1 centimeter to somewhere around 10 centimeters as well. And the location of the fibroid, this is called as uterine fibroid, and this fibroid, where is it located, also can cause the infertility, because certain locations might not completely disturb the process of pregnancy, and henceforth will not be very problematic to the patient in conceiving, like the fibroids which are located completely away from the endometrial lining. So this is called as subserous fibroid, and if it is located outside towards the outside covering of the uterus, then it is not causing much difficulty. But definitely if it is of more size, sometimes it can cause difficulty, because of it will create an abnormal movement of the uterine musculature, and sometimes can cause even expulsion of the embryo, or it will cause abnormal uterine contractions and cause miscarriage. Only if it is of a huge dimension, then it is going to cause difficulty. The other fibroid is the submucosal fibroid, where it is closely located to the endometrial lining, if you can see here, and this will cause the decrease in the uterine cavity size and hence decrease the chances of the embryo getting implanted and end up in infertility. And also, by chance, if the embryo has implanted nearby, it will decrease the blood supply to the embryo also, and also because of the abnormal uterine contractions that the fibroid creates, it can decrease the it can increase the chances of the abortions. So the other fibroid is the type is the intramural, completely lying within the uterine musculature. These fibroids, if they are less than 4 centimeters of small size, not touching the endometrial cavity, cannot pose any difficulty in infertility or recurrent pregnancy losses. But if it is encroaching the uterine endometrial lining, then there is a chance, or if it is of huge dimension, then definitely it can cause difficulty. And in those patients, treating the fibroid by removing the fibroid temporarily can help us to help them conceive. So sometimes, as I said, if it is encroaching the endometrial lining, it can also cause some changes in the endometrial implantation markers that are there in the endometrium, and hence cause infertility or recurrent implantation failures. So there's another condition after the fibroid being the most common. The other most common condition now we are seeing is the adenomyosis. Adenomyosis is nothing but the endometrial glands or the tissues sweep from the endometrial lining into the uterine musculature and develop there and cause inflammation there and cause difficulty or blood secretions to be collected within the uterine musculature, and they are responsive to the hormones that are usually there in the menstrual cycle and cause severe pain when they are having a menstruation. So this is nothing but this uterine lining or the endometrium has disrupted the regular lining and has gone into the uterine musculature. This brown colored spots are the bloods that are blood glands or endometrial glands that are present in the uterine musculature, and therefore every time the patient is having menstruation, even these spots have menstruation, and that is the reason patient usually has severe pain or severe dysmenorrhea, what we call, during the menstruation, and that is a typical symptom that the patient can have in a condition of adenomyosis. So this here is a clear picture where the uterine musculature is here completely normal without any endometrial glands, and here there are endometrial tissues present, and these will respond to the regular hormones and cause bleeding inside the uterine musculature and cause severe pain. And also this adenomyosis is known to disrupt the endometrial implantation markers and cause infertility. So the other or the most common condition that we see is the uterine polyp or the endometrial polyp. Endometrial polyps are nothing but overgrowth of the endometrium at certain locations. Sometimes they can be pedunculated with a stalk, and sometimes they can be completely sessile without any stalk. But because if these polyps are more than 0.5 centimeters in diameter, they start producing symptoms or occupying much of the uterine cavity, and therefore can cause difficulty in the embryo to get implanted. And also, even if by chance there is an implantation, it can cause abnormal uterine contractions or the endometrial contractions and cause miscarriages. Polyps usually are also known to produce hormonal imbalances in the menstrual cycle, and patients sometimes may have heavy menstrual cycles, or there might be intermenstrual spotting. So if anybody of you are having any of these symptoms of heavy menstrual bleeding, intermenstrual spotting, or some amount of mass is being felt per abdomen when you're palpating yourself, there might be some uterine cause underlying, and that might be one of the reasons why you're not able to conceive. These are the most common uterine abnormalities that we see. There are certain other conditions, like if a patient has undergone a hysterectomy due to some reason, sometimes it is such that patient has gone for a fibroid surgery where the bleeding was very severe, and to save the life of the mother, or to save the life of the woman, there was a necessity to remove the uterus completely. So in those patients also there's complete absence of the uterus, and hence therefore they have to visit a fertility consultant to achieve the pregnancy. Also, because of the cancer, due to cancer in any other organ, or the uterine cancer itself, or ovarian cancer, cervical cancer, there are patients who undergo radiation or chemotherapy that can damage the uterus, uterine lining, uterine musculature, and hence result in infertility. So this could be one of the reasons why the patient is not able to conceive. So these are the most common uterine abnormalities that we encounter. Whatever might be the uterine abnormality, there is definitely some amount of, or definitive treatment that we can give to the patients who are suffering from these uterine abnormalities and help them conceive. So I would like to request the patients whosoever are watching this video to see if they are having any of these abnormalities or symptoms, and then they can come and visit me to analyze what factor they are having. We can do a basic ultrasound and then analyze their uterus and help them understand why they are not able to conceive, and give the appropriate treatment necessary for the appropriate uterine abnormality that